Okay, so getting into psychological reactance theory, I love this theory. It's really interesting to me because I feel like I'm probably high on psychological reactance, and yeah, I love this theory. So let's define perceived threat first, because that's kind of where this starts, where we develop these reactance behaviors. So perceived threat is a perception that one's freedom or ability to make choices has been limited. So your mom says that you can't go out and get ice cream with your friend because you didn't clean your room. So your freedom, if you live with your parents, is that you can go out and hang out with your friends, but like your mom telling you that you can't because you have to clean your room, that's limiting your freedom, right? So this is often manipulated by forceful language, and examples of this are you must brush your teeth or you have no choice, and then you must be home by 10 and you have no choice. So it's like you must do this, and like you have no choice of any other options, and that's the use of forceful language. So I hope that makes sense. I think that makes sense. Let's introduce psychological reactance, which is the motivational state occurring when a freedom is threatened or eliminated. So you'll hear a lot of people refer to this as like reverse psychology, and that's fine, and you can refer to it as that, but you need to also know in terms of your exam and like for this class that it's actually called psychological reactance. So they're kind of one and the same. It's measured by negative cognitions and anger. So negative cognitions are like negative thought process or negative thought processes, and anger. Some people are more prone to this. So some people have higher aggression levels, and it makes them have like a higher reactance to a freedom threat. And this can, I think in your book, it talks about trait reactance. So this is just like some people just have more, they're more likely to live in this state of psychological reactance. Like anytime you tell that person that they can't do something or that they have to do something, they will always do the opposite of what you tell them to do. And that's just like their personality trait, as opposed to like state reactance, where it's like one thing. If somebody tells you one time to not do one thing, like I have a strong reactance toward parking tickets or parking rules, but other than that, I'm a major rule follower. So yeah, there's like state versus trait, which state is situational, trait is more characteristic of your personality. And then let's define our freedom restoration behaviors. These are attempts to take back one's freedom to choose, and usually following a persuasive message that elicits psychological reactance in the participants. And examples of these are doing the opposite of what the source says to do. So if your mom tells you to brush your teeth, you're not going to brush your teeth, so you restore your freedom. That's just like a little example. Or saying bad things about the source. So these are like way more negative freedom restoration behaviors, but it's like not only are you not going to do what this person told you to do, you're either going to do the opposite or you're going to do something that like negatively impacts them. We'll watch this video. This helps explain it pretty in depth.
Hey, you know those chores that you probably have to do? Dishes, laundry, vacuuming? Yeah, they're not important. You should probably just forget about them. I don't know if you actually feel any more motivated now, but reverse psychology is the idea that you can persuade someone to do something by telling them not to do it. It might seem like something that only works in cartoons, like a big red button that says, "Do not push." But researchers have studied reverse psychology, and it does seem to have an effect on real people in certain situations. When scientists talk about reverse psychology, they focus on something called reactance. You know that "you can't tell me what to do" feeling? That's reactance. This idea was first proposed in 1966 in a paper on psychological reactance theory that synthesized a lot of thoughts and research about this internal process. The author suggested that when we're given instructions to do a particular thing, we feel our freedom of choice becoming restricted. For example, on your own, you can choose to do whatever you want. Watch a movie, go to the park, eat a corn dog. But when you're told to do something specific, your freedom to choose other things feels like it's more limited. Psychologically, that can be uncomfortable, and that discomfort can motivate you to fight back to regain that freedom of choice. So you might disobey, like, no, Mom, I'm not gonna clean my room. I'm gonna probably sort my Magic the Gathering cards, if we're talking about me back in high school. Even if you didn't even want to sort your Magic the Gathering cards, more options lead to less discomfort. Of course, reverse psychology isn't just a thing for rebellious kids. Research is actually mixed on whether younger or older people might be more susceptible to stronger reactance, and it's tricky to compare ages because of other life factors. But psychologists do know that people of all ages experience reactance, and in lots of situations, from taking advice from a friend to listening to a public health message. For example, when the US drinking age was legally raised to 21 in the 1980s, psychologists noted behavioral changes between college students of different ages. One survey looked at 3,375 college students during the academic year between 1987 and 1988, and they found that 81% of students who were younger than 21 drank versus 75% of students who were 21 and over. Underage students also reportedly drank more heavily. 24% were considered more likely to make risky decisions or to be heavy drinkers. Basically, having a lot of drinks fairly often. Only 15% of legal drinkers were in this category. You wouldn't expect such a drastic difference without some cause. And sure, there are a lot of factors that go into the decision to drink, but the researchers suggest that this trend was partially because students were reacting to limited freedom, to reestablish a sense that they could choose whether to drink or not. Another survey looked at 2,142 students from 10 schools in 1990, and they saw significant differences in alcohol use if people were 21 or not, but not other drug use. The researchers say that further supports the idea of reactance, because the changing drinking age was a big deal to behavioral freedom. The kicker is, reactance can cause people to go against lots of best interests, even ignoring medical treatment plans from doctors. A 2014 study that looked at depressed patients found a strong link between high levels of reactance and refusal to take medications. 119 psychiatric outpatients being treated for depression were asked to fill out a number of questionnaires, assessing their psychological reactance, how in control they felt, self-efficacy, and how well they were adhering to the medications they'd been prescribed. And their responses showed a distinct negative correlation between reactance and medication adherence. In other words, stronger reactance meant they followed their treatment plan less. The authors of the study concluded that it might be helpful for mental health professionals to find ways to communicate with patients that avoid creating high levels of reactance. One strategy could be giving patients more tools to make decisions instead of explicitly telling them to do or think something. For example, motivational enhancement therapy emphasizes patients' freedom of choice, and these kinds of therapies are often used to treat cases of drug abuse or alcoholism, rather than a therapist pushing a particular choice, like stop taking all those drugs, dude. The therapist and the patient work through the pros and cons of each approach to the issue. This way, the patient hopefully feels less limited and reactance is less likely. Ideally, they're more likely to carefully weigh all of the strategies and choose to take steps towards recovery. We all have heard about this. You have to make people think it was their idea. Reactance is just one of many factors that affects how likely someone is to take advice. It's not a surefire way to persuade anyone. But if you're feeling lucky with a stubborn nephew, who knows, maybe a little reverse psychology will do the trick. Thank you for watching this episode of SciShow Psych. If you enjoyed this video, definitely don't leave a comment, and don't you dare subscribe.
Okay, so I think that's a perfect way of explaining all of that. So I hope you found that helpful. And I think it's really important to apply everything that he just said to where we are today with public health messages and why certain things with the COVID-19 pandemic did not work. Some of the messaging did not work. So yeah, we're going to take a short break, I think. Yeah, and then we'll get into more about psychological reactance.